This is an ABP Live Podcast.
Hello everyone, you're listening to Ladies First on ABP Live Podcasts, and today is International Women's Day. So wishing all the women and men out there a very happy International Women's Day. And आज का दिन celebrate करने के लिए we have a very special segment. Today we are going to clarify and answer all your questions and queries around the female sexual hygiene, female reproductive systems and everything that you need to know with one of the experts of the topic. Today we have Dr. Ritu Punhani. Hello ma'am, how are you?
Hello, I'm doing good. At the very outset, I would like to thank you for this opportunity and wishing you all the viewers a very happy International Women's Day.
Thank you so much ma'am, and it's my pleasure to take this platform and use it for all the women out there who have a lot of questions, and we have to agree that even at this point there is a lot of taboo around the entire concept of sex, around the entire concept of sexual hygiene and female sexuality as a whole. So even with gynecologists, even with their own gynecologists, a lot of times girls don't feel comfortable asking a lot of things that they ultimately end up googling. And उसमें कितना हमको सही answer मिलता है, कितना नहीं, we can never be sure. Today we have curated a list of questions that girls have googled and they want to know the answers to, and that pertain to the entire concept of gynecology and female sexuality. And उसके लिए ही आज हमारे साथ है Dr. Ritu. So, Dr. Ritu, you are a gynecologist, you are an IVF specialist. So, I wanted to know more about you and how you got into the entire realm of gynecology.
You know, I think as we say, learning starts at home, you know. So
Absolutely.
both my parents were doctors and my mother was a gynecologist. So that's my inspiration. So my mother was my true inspiration for the gynecology.
Right.
And now how I landed up in infertility is, you know, like when you are doing your post-graduation, obviously you come across a lot of patients.
Right, absolutely.
And we used to have various OPDs in different timings. And infertility OPD used to be only once a week.
Okay.
And the timings used to be like, 2 to 4. So it was like, it
Too
was
less.
a late setback
Right.
sort of a department. Everybody used to think it's not that important.
Right.
But I feel that is the most important thing we are facing right now. It's like
Absolutely.
a rampant at present.
Exactly. And a lot of people don't even know about
Yeah,
it.
so coming across those couples, and the mental trauma they're going through.
Right.
I still remember one of my teachers told me at that time that infertility is just like cancer. So like once you get cancer, you're really worried whether you'll be cured or not.
And there are always a lot of questions around it.
And which are unanswered.
Exactly.
So similarly,
exactly.
infertility, one who has it only can experience it.
Absolutely.
And know the pain they have and they have to go through.
Right.
You know how big social taboo it is.
Right.
How people,
right.
They seclude you from the society just because you are in this
People
infertility.
don't marry their long-term lovers if they find out such things.
And they're even ready to leave them for the same.
Exactly.
The society doesn't accept women if they're not able to conceive.
Right.
So I thought it's the best way to help these childless couples.
Absolutely.
And turn their dream into reality with whatever best we can do for them.
Exactly. So how has your experience been till now?
I think my journey was fantastic, It started as with my MBBS post-graduation, and then finally I turned into infertility specialist. And then, with this Indira IVF platform, I got to, really fulfill my dreams and as well as the dreams of the world, or you can say our country and people.
Right, absolutely.
To give them a child and the happiness they're yearning for.
Exactly. So, ma'am, can you tell me a little about IVF? Like, it is, as you said, it was a solution towards infertility. But a lot of people have no idea about it. So, can you tell us a little about it?
Yeah, people, when you say they don't have an idea, it's very true. When they come to us, they feel we are producing a baby, artificially.
Right.
To be abnormal. Right. It's not going to be normal like why people have it when they conceive naturally.
Exactly.
So basically, IVF is one of the methods of helping the patients to treat them with infertility. So depending on the indications, patient can be having indications in the mother, or you can say the husband or the female partner. So I'm not going into the indications who need IVF, but in short we can say like if somebody has diminished ovarian reserve, means they have the number of eggs is less. Or if they have some problems in their semen samples, the males have female, they have irregular cycles, the tubes are blocked, they have endometriosis. So these are the common things when people present to you and we advise them to have.
So these
IVF.
are the causes mostly
common
about
indications.
Okay, right.
So what we do in IVF is, the word says in vitro fertilization. So in vitro means you're doing it somewhere outside the body.
Right.
So with different methods, like you stimulate the women, means you give her injections. You procure the eggs from women.
Okay.
You take the semen from the husband.
Hmm.
Then we buy a procedure of in vitro fertilization, or you can do an intracytoplasmic sperm injection, that's ICSI.
Okay.
We inject the sperm into the egg.
Okay.
And then we follow it up after day 5 it's kept in a lab, in an incubator,
basically in an
in the
external
environment. But an
system.
environment is just like you have in a woman. So
Okay.
it's like,
Okay.
it's a closed chamber with the same environment.
Okay, right.
So at same 37 degrees what we have in our body.
Hmm.
So then we keep it there, and it's after 5 days we see whether the embryo, the baby which is formed as a result of IVF after day 5, you can say would be an embryo.
Okay, right.
So that's the blastocyst stage, means that's into technicalities.
Right.
But then once the embryo is formed, then usually to have a good success rate, because one more important question people are worried when they do IVF is, it's expensive. So whether
Right, exactly.
we'll be able to afford, whether we'll get pregnant in first attempt or not. So to increase the success rate, we take the embryo to 5th day, we freeze the embryo, that increases the success rate.
Okay.
Then we do
okay.
a frozen embryo transfer at a later date.
Okay, so
But-
this then it is transferred
Yeah,
into
so
the
once
female
it's
body.
it's
Right.
transferred, you can say it's transplanted into the uterus of the female. So once that procedure is done, then again we prescribe in some medicines, and after 14 days we do a blood test called as serum beta HCG,
Okay.
and that will let us know whether patient has actually become pregnant or
Not. Okay.
So people are anxious, they keep checking with the UPT kits on and off in between. But
Right.
then obviously the best time to do the test and the best way is to do with a blood test.
Blood
So it's
test,
serum beta
right.
HCG.
So of course patience takes a hit in such
True,
things,
true.
but if वही कुछ पाने के लिए कुछ खोना पड़ेगा और थोड़ा wait करना पड़ेगा, सब्र
Yeah,
करना
patience, is really, really important,
Right.
To give anything in life, I think you have to be patient. And
Absolutely.
similarly, so it's here,
पड़ेगा. Exactly.
So day 1, we have to tell them, see, don't think that, because, they'll come, Indira IVF, it's one of a big referral center. So it's one of the largest chain of infertility and IVF management.
Right.
So patients, when they come here, they come with a hope that, that we have been to several places and now this is our last resort.
Right.
So we have to counsel them. Don't think that in 1 month or 2 months, if you don't become pregnant, that's the end. No, you have to give us time and we will do it.
Right. There is always scope.
Yeah, obviously. So there might be cases, but majority of them, obviously, we'll be able to help them in some way or
Right.
other.
Absolutely. So, doctor, if we talk about reproductive health and sexual health in women, how aware do you think women of today really are? Like, there are hundreds of things, there are hundreds of issues that might go wrong inside a female reproductive system. So, how aware do you think women are at this point as far as their reproductive health is concerned?
I'm sorry to say, but I think not we, but the women of India are not actually aware
Right.
about the problems and the reproductive health, the sexual health. Again, it's a taboo. They don't even want to speak about it.
Right. And even when they want to, they are too embarrassed
too
to
embarrassed
talk
to
about
speak
it or
about
ask
it.
about it.
Just for example, even if some patient is having a urinary tract infection, so it's nothing to be offended about having.
Right,
But they're
exactly.
scared to discuss that. They feel they're having UTI, so it's a big problem. They can't discuss.
Right, exactly.
But UTI, as you see, it's one of the almost 50% patients in one or the lifetime would have definitely,
would
had a
definitely
UTI.
face it. Right.
Again, it's because of if you don't follow safe sex practices, also one thing. You don't drink plenty of fluids,
Right.
and if you don't, wear cotton clothes, you keep your private parts clean. All these things will lead to urinary tract infection.
Okay.
So you have to even have the safe and clean washrooms. That is also important. So if you
Right.
use too much of washrooms outside, you have to see to the cleanliness.
Right.
Nowadays, you even get some sanitary pads and some sheets which can be actually used to clean the toilet seats when you basically go out and use.
Do you think that all these products that Pee Safe and stuff like
True,
that,
true.
are
I was
they
not getting the name. I wanted to talk about PSA.
right? So do you think that they are effective? Like even I, as a person, I use it whenever I use a public washroom. So is it effective? Should women use it?
I'll say that it's not causing any harm.
Right,
So why not
right.
use it? You keep yourself clean and the environment clean, and obviously things would be in your control.
Right.
I think it's advisable to use it. Means I cannot recommend the brands and all
Yeah,
that.
yeah, absolutely. But
Obviously,
it's good to
it's
use a
something
product.
You can use a product.
It is after all a hygiene product that will help
so
you
it
out.
won't cause any harm, so why not use it?
Exactly. So, doctor, if we talk about the fact that sexual health and reproductive health have become a very important part of women's life, and the fact that people are getting aware about it, so do you think that it is somewhere related to our mental health as well as far as women are concerned?
I think you brought up a very important question, because sexual and mental health are actually related to each other.
Okay.
Very much. See, I think you can understand that you, especially even in a couple, if they want to have a happy life, you think sexual life forms a major part of it.
Right, absolutely.
So if somebody is not interested into sex, or they have some inhibitions with the sex, there could be several reasons for it.
Right.
And one of them is nowadays people are so much in stress, depression, anxiety. So all these problems, they inhibit them from having sex. And so when they don't have a normal sex life, it really ruins their relationship, I feel, So
Absolutely.
I think that it's very important to be mentally relaxed, and then only you can have a good sexual life.
Definitely. So we have curated a list of most googled questions that people want to ask their gynecologist, and that is how we want to answer all the queries and questions that there are in the minds of young girls, of young women, of even older women who want the answers to these questions. So today, since we have an expert with us, Doctor, I'm going to ask you these questions and you can let us know the answers. I'm sure that it will be a perfect gift for Women's Day for all the women out there.
Let's hope so.
Yes. So let's start with the questions. So I think one of the most, major, biggest query in the mind of every woman out there is sex supposed to be painful?
See, having it for the first time, probably you can have the pain.
Okay.
But by repeatedly having intercourse, you might not have pain.
Okay.
And if somebody is having pain recurrently, then there might be a problem. Then pain can also depend whether it's happening only in the vagina or you're getting a pain when there's a deep penetration you're having in the lower part of your abdomen.
Okay.
So if it's in the vagina you are having pain, you can relate it to some infections. Not
Okay.
every time, but only
Right.
if it's an unbearable pain. Sometimes it might be just discomfort. But you should not ignore it. It's always better to consult a doctor and clarify your doubts.
Right. Absolutely.
And suppose there's a deep pain, only when you're having a deep penetration, you're having a pain. In that case, there might be some pelvic infections, endometriosis, some any other infections, even urinary infections can interfere with
Right.
the sex life. So in that way, these can also be the causes of pain during intercourse.
Okay. I'll be honest here, a lot of my friends also faced an issue about the question that I'm about to ask. A lot of people, after they have sex for the first time, they catch a UTI, a urinary tract infection. Is it normal and why does it happen?
See, you can say it's normal in the sense because there's a very much difference in the anatomy of the male and female.
Right.
So what happens is in the females, the urinary tract, the urethra from which the urine comes out is very short. It's only around 4 centimeters.
Okay.
In males, it's a long urethra. So whenever you have intercourse, the infections which might be there in the vagina, they have a chance to enter into your urethra and into your bladder.
Okay,
So
right.
the tendency of having infection, urinary tract infections, is more common. We in fact call it honeymoon cystitis.
Okay, right.
So many women after their marriage, after their first nights or after their honeymoons, they'll tend to have this.
Okay.
So it's a common problem.
So it's not something that
To be
only a
scared
few
of.
of people.
Yeah, but you should
people
talk
go
about
through.
it.
Right.
Because people do present to us with this complaint and we do tackle them. It's very
Right.
easy to manage, but they have to be open and discuss your problem.
Okay. And you answered another one of our questions that what is a UTI? You did in the beginning. So how can, of course, you have to go to a gynecologist whenever you face
Feel.
certain discomfort. But what is a solution to a UTI?
See, UTI, as it says, it's a urinary tract infection. So we first find out the cause. Maybe, like I said, honeymoon cystitis. If
Right.
anything is, okay, whatever be the cause, management is going to be the same. One thing is the water intake might be less for the patient. So if you drink plenty of water, you pass urine frequently. Don't hold your urine for a long time. You should not be holding it 4 hours, 6 hours, 8 hours because you're outside. So when there's something stagnant, there's always a chance of infection.
Right.
So if the urine is held in bladder for a long time, you can get infection. So drink plenty of water, hydrate yourself, and pass urine or void urine frequently. Don't hold your urine for a long time.
Right.
Then if you come to the management proper, basically urine will be acidic, then it will cause burning sensation. So we give them alkalizers. So everything which is going to alkaline the urine, the pain will be less.
Lesser. Right.
Then you have to identify the organism which is causing the infection. So you do a urine routine and a culture test. So culture will tell you whether the patient is having which particular organism is infecting.
Okay.
Then the antibiotics can be given as per the diagnosed infection.
Okay. And when we talk about discomfort, again, another thing that comes up is vaginal discharge. So a lot of women face it. So is vaginal discharge normal, and when do we think that okay, now this is not normal and I need to consult a gynecologist?
See, as far as you have a vagina, you'll have a discharge.
Right.
Okay. So now anything abnormal is whenever it is excessive or it's foul smelling. So
Right.
minimal discharge is normal because that discharge only keeps your vagina clean. It keeps renewing your vaginal discharge. The bacterial flora will again renew. So it's a healthy thing.
Right.
But suppose it has an offensive, foul smelling, it's causing you itching, burning, then obviously you need to consult a doctor and find out the cause.
Okay.
Because there are many infections and most of the infections are related to sexually transmitted diseases.
Okay.
So
right.
if you have safe sex practices, that is also one way of decreasing the infectious discharges.
Okay, and you mentioned a foul smell. So our private parts are supposed to have some amount of
Because
odor.
of pheromones, they'll always have some odor.
Odor, right.
So, but one would know that it's abnormal, it's offensive. You can't bear the smell.
Right,
Like even if you
right.
have pain, you know the intensity, whether you can bear it or not.
Right,
Similarly,
exactly.
the discharge, even the color of discharge might be changed.
Okay.
The consistency might change.
What is the normal color of
See, normally
vaginal
you
discharge?
can say it's colorless to white, but it will be transparent usually,
Okay.
But suppose it becomes very thick and curdy white, and if you try to, stretch it between your fingers, so you can even time the ovulation and whether it's a fertile period or not with that,
Okay,
So if it's stretching well in between your fingers, it's like a spinner bucket effect we read in our physiology and all.
Right.
So then obviously it is a fertile
Problematic.
period.
Okay.
It's a fertile period.
Oh,
and if
okay,
it's
okay,
very
okay.
thick and you can't stretch it between fingers, that means it's not a time that you can have pregnancy. So it's a safe time at that time to have intercourse.
Okay.
So
right.
usually in the later half of the cycle, you'll have a thick discharge. In the early part, you'll have a thin discharge.
discharge.
There's something called as waterfall cascade,
Okay.
So like during the ovulation time, that's the maximum time you have the discharge. So
right.
generally we ask the patients, okay, what time do you have? It's roughly, suppose somebody has a 28-day cycle. So somewhere around day 14, that is the middle of the cycle, they have ovulation. So that is the time they have a excessive discharge. So we call it ovulation cascade,
Okay. So basically ovulation happens in the middle of your
in a
entire
28
cycle.
days cycle, if somebody has a regular cycle of 28 days, it generally happens 14 days before that.
14 days before.
Yeah, so if somebody has a 35 days cycle, you can say it will happen 14 days before that 35 days. So that will be 21st
So
day.
basically somewhere around the middle of the month, we can say. Right. Okay. So talking about another thing that is doing rounds on the internet these days a lot, HPV vaccine. So what is an HPV vaccine? What is the age group in which one should get it, and what is the issue for which we are getting this vaccine?
See, I think Government of India has also done a lot of work on this adolescent health, because this also forms a part of both adolescent health as well as reproductive health.
Okay.
Because you have to catch the disease in time, to prevent
Right, to
it.
cure it after all.
So as you talk about HPV vaccine is for cervical cancer.
Okay.
Okay, it is one of the second common cancer. The most common is breast cancer in India. Second common is cancer cervix.
Okay.
Now this vaccine is suitable for candidates who are, basically it's better to give them before they start having their reproductive or sex life.
Okay.
So the
right.
ideal time is you can start from 9 years itself.
9 years?
Yeah.
Okay.
In the school itself. So 9 years to 15 years.
That is the best time. Okay.
Catch
So that
them
is
at
the
right
best
time.
from 9 years to 15 years is the best
So
time for
usually
HPV
if you
vaccine.
give them between 9 to 15 years, you need to give them only 2 doses.
Okay.
So you give the
Okay.
one dose, like suppose today is 0, you give first dose. And then the next dose can be anywhere after 6 to 12 months.
Okay. Okay.
Now, in case somebody is getting the vaccine after they have been exposed to the sex life, suppose after 15 years. See, all these ages are from the West. We don't have any Indian data
Indian
for
ages,
this.
exactly.
So,
exactly.
In India, not that common, but obviously in abroad in West, at 15,
Post
16,
15,
girls
yeah,
are
it's
actually sexually active.
Sexually active, exactly.
So then the next age is 15 to 45. After 45, nobody would take that vaccine.
Right,
So
right.
you're preventing yourself. So after that, the risk of having CS cervix is very, very negligible after 45. So what happens is if this vaccine you have already exposed, you'll have to take 3 doses. So you take the first dose, suppose day 0. Then the second dose has to be minimum at least 4 weeks apart. So you
4
can say
weeks.
1 to
Okay.
2 months. And then again the next dose again it has to be minimum 5 weeks from the first dose. So you can keep it again 6 to 12 months.
12 months. Okay.
So this
Right.
vaccine, till now it has been only been imported from the West. It comes by 2 names, Gardasil and Cervarix. Although I cannot brand names, but these are the names available.
Right.
But I'm sure you must be knowing that recently, Serum Institute has launched a vaccine
Right.
named
Right.
Cervavac.
I think a couple of months back.
Yeah, so it's still not available. It will be soon available, Cervavac.
Okay.
So they are suggesting from 9 to 45 and they are suggesting 2 doses.
Okay.
Cost and all again is not revealed as of
Revealed
yet.
yet. Okay.
So with this vaccination, again you have to stress on the fact it will not prevent from cancer cervix 100%.
There is
Because
always
there
a gap
are,
somewhere.
the reason being, HPV there are numerous strains. So generally it is 16, 18, 31, 33 which are the most common.
Right.
So when I spoke of 2 vaccines, Gardasil, that's a quadrivalent. So it acts against 4 viruses.
Okay.
So
right.
if somebody is getting cancer because of those 4 viruses, it will
So
prevent
it will
you.
prevent,
But there are
right.
so many strains, you can't have a virus which will prevent you against all the strains.
Right. I think we
So
saw this during
to-
COVID
yeah,
also. There are
absolutely
multiple
right,
new,
yeah. New strains which keep coming up.
Exactly. And we can be vaccinated
To
and
one,
yet we
yeah,
can
still
be
you get
exposed.
COVID.
Right.
So
exactly.
because of that, even if you're vaccinated, you still have to follow the safe sex practices.
I think
Because
safe sex
it's
practices
again
is the
happening.
core for
HPV
most
is
of
also
all
a sexually
things.
transmitted infection.
Right.
And although it's a Women's Day, but it is important that this vaccine is available both for men and women, for girls
Okay.
and boys.
Okay, so HPV vaccine is
Yeah.
available for men as
Yeah,
well.
for girls and boys, it's recommended for both.
Okay, but how does it
Because
work
it also
for
prevents
men?
against anal cancers and all, because
Acha,
anything which is associated
okay.
with HPV, any infection, warts and also it's both for men and women. So both
Okay.
girls and boys, many times our colleagues which are non-medicals, they have called us and asked us in the school, because nowadays in the West at least schools are taking initiatives,
Right.
that from school age itself they're starting giving vaccines. So should we give to our boys? They'll say, I said, yeah, you can go ahead. Because
This
it is
is something that
recommended.
even I've never
This is a
heard
part of
about it.
adolescent health
Right.
now,
That is great, and even I got to know something new today because I never knew that even men have to take up HPV vaccine. So that's great. Okay, so what is the most effective method of birth control, and are there side effects to birth controls as well?
You're asking this question to a wrong person. I'm putting infertility.
Right.
But no, the answer should be for the audience. See, there are various methods. Some are long acting and they're reversible. Some are long acting, they might be permanent. Some are short acting and they're reversible. So if you talk of long acting reversible, the best are intrauterine contraceptive devices, commonly known as copper T for general public.
Right.
Although it comes in various names and brands now. So that is one of the best methods because it is almost 99% effective and not many problems does a patient face. You don't have any compliance with it because it's just inserted inside your uterus.
Okay.
So it's lying there dormantly, it's doing its job and it's not making you do anything.
Okay, right.
But if you come to short acting, which can be oral contraceptive pills or there can be even be some implants and injections, hormonal preparations are available.
Right.
But then you have to be very compliant to it. If you miss a pill, then obviously the efficacy will go.
Right, absolutely.
Then it could be, what I said, permanent could be sterilization. So if you do a sterilization procedure, now that would be done in patients who are very sure
But
that
they don't
have one
want.
or two children or whatever it is, they don't want any more child.
Right, exactly.
But since we have come into this field of infertility, we are facing this problem that couples are coming even at the age of 40 and 45 and they have been unfortunate to lose their child at that age, 22 years, 20 years. Even at 35 people have come and they've lost their children. For some, somebody has drowned. We have faced these cases. So looking at that, I feel that I think sterilization per
It's
se
a little too extreme,
little too
maybe.
extreme. So I think we can go for long acting. I mean, that's my opinion. It can be
Exactly.
different.
Definitely.
So everybody has a different point of view. So, but ideally, I think copper T. Otherwise, if somebody wants a temporary method, copper T is the best. And then, other than that, you can use contraceptive pills. But with the pills, you get a lot of side effects, which are not there with intrauterine devices.
Right. And if you talk about female condoms, they have also been talked about a lot. But I don't know if they are.
I think in fact I missed
public
it.
and
Similarly,
for people.
barrier contraception is one of them.
Right.
So in males you have condoms, in female you have FemShield, there's a female condom.
Okay.
Again, the problem is of usage. You have to be very compliant and you're consistent in the usage.
Right.
So it's not commonly used also here.
Exactly.
And not
That
very,
was my main thing, because if everyone has heard about it, everyone knows about it, but I'm not sure how much in use it is.
Yeah, it's not very much used, especially in India. It's not very much used.
Right.
Here, more of them people are using is male condoms as
Exactly.
contraceptives.
And are there any side effects to the birth control methods that you just mentioned?
Yeah, there can be several side effects. So most common is like when you take these pills, because they're ultimately made of estrogen and progesterone.
Right.
So you can have headache, nausea, vomiting. You might feel bloated. The breast might be heavy. Then people who are having diabetes and hypertension, especially uncontrolled, they should not take these pills because they have a tendency to develop diabetes and hypertension if you take it for a long time.
Okay.
Then one more thing is, it has a tendency to thicken your blood. Oral contraceptive pills, if taken for too long continuously. So you better keep yourself hydrated. Otherwise, they can be, blood clots can form and they can block your heart or brains. So they can cause strokes, thromboembolism. So you have to be really careful and look out for the symptoms if you're taking such things.
Right.
So we really don't recommend taking OC pills for more than 10 years. If somebody is taking, it's always ideal, skip few months or few years in between and then if
start
somebody
it
wants
again.
to take. Yeah.
Right. Okay. And doctor, as you mentioned also that two of the major cancers that females are at risk to are of course cervical cancer and breast cancer. So a lot of women want to know, we are aware that there are certain self-examination methods. So can you tell us that how can females self-examine themselves as far as breast cancer is concerned?
See, again, prevention is better than cure.
Absolutely.
So once you identify it, especially early, the better would be the treatment.
Right.
So now breast self-examination, as per the guidelines of the cancer societies, they say you should start at the age of 20 years.
Okay.
So usually you should stand in front of the mirror, exposing both your breasts. First you can keep your hands at the side, arms on the side. So you can see the difference, if there's any difference in the size of the breast or there's any puckering or anything abnormal between the two.
Okay.
Then what you can do is you can raise your one hand, like either first right or left, above your, you can keep it on your head. And then you see and feel for the breast. Now how you feel for the breast is very important. You should not be using the tip of the fingers. Okay, so you should not be using the tip, you have to use the lower part of these fingers and the palm, and then you keep feeling it, and then you have to look for if there's any nodularity, any thickening, anything abnormal which you feel.
Okay.
You even have to feel your axilla, because sometimes there are some lymph nodes which might connected to the breast and they might be palpable there.
Okay, right.
So you feel one side, then you feel the other side.
Okay. Right.
And the signs and symptoms would be like anytime if you feel there's any pain in the breast, any abnormal discharge, any puckering, skin looks red. So anything abnormal, then obviously you have to contact a doctor.
And doctor, you talked about one thing, that a difference in the size of the breast. Another question that I got in the list of most Googled questions, is it normal that there is a difference in the size of both the breasts?
Basically, I said that and I was thinking you might ask. At times there is a slight difference, But then you would know it from the beginning that difference is there. And you can follow it up, and then usually there is a slight difference.
Okay, so that's normal.
Yeah,
that's normal. Okay. So talking about menstruation and periods, a lot of girls have a lot of questions around the fact that if my flow is very heavy or if my flow is too low. So what is normal, and having like low and heavy flow, how does it like sort of enter the entire realm of menstruation?
Same as in contraception, one size doesn't fit all. So similarly here we can't really define that, okay, this is normal for that person. Because menstruation flow, duration depends from person to person.
Right.
So now normally, I had already mentioned once before that normally the cycles are like 21 to 35 days. On an average we say 28 days is a regular cycle.
Regular cycle, right.
So if somebody has short cycles up to 21 days, we can consider it normal. Maximum 35 days, again you can consider it normal.
Okay.
Now on an average, if you say, we can say if 3 to 5 days if a patient has a flow or a girl has a flow, that's normal. If you have only 1 to 2 days flow, very little flow, you're not even changing 1 or 2 pads a day, obviously it's a scanty flow then.
But that is also normal?
Yeah, that's normal, but then there might be a problem, so they should consult the doctor once to check out the reasons. Similarly, somebody might have excessive flow, like you have flow for 6 to 7 days and that's a heavy flow. Suppose you're changing 3 to 4 or even 6 pads per day, then obviously it's more than normal. So again, you have to look into the cause why it's happening.
Right, right.
If we assure you and if we check everything that there is no problem, then you have to be rest assured that okay, it's less.
Right.
But if it's heavy, there can be so both things they have reasons. So we
Right.
rule out any common problem, and if we counsel and assure you, then you don't have to worry.
Okay, so basically anything that you feel is a little abnormal, definitely get it checked by a gynecologist.
Because I always feel the problem is we are not vocal about it.
Right, that is
So
the
nowadays,
main problem.
Even the CBSE board, they have included a class, I think, in the schools of on sex education and adolescent health.
Right.
So they are educating them about all these menstrual problems, menstruation, safe hygiene. Hygiene is very important for menstruation.
Very important, exactly.
How to procure the pads, because when we are talking of in India, we are like having more of people who are socially economically deprived.
Exactly.
We are not catering just to the high class or upper middle class. So most of our population is living in the villages and still going to government schools.
Right, and they'll probably not even have the access to pads.
So government is trying to do their best, provide. Even they are helping them to provide with pads. You can get pads at a very cheaper price.
Right.
And these ASHA workers and all from NHRM, they are being trained, how to counsel these people about safe sex, so this safe menstrual hygiene practices.
Right.
And more important is how to dispose these pads, because again that becomes a menace for the society if you don't dispose them. It's a
For the
biohazard.
waste management as well, it is an
so
issue.
that itself is an issue.
Right. Okay, and talking about periods, is it okay to work out during periods, or is it preferred that we shouldn't?
No, if your body is comfortable, it's allowing you can go ahead. There's no problem.
And what is the best way to cure period cramps?
The best way to cure period cramps, the best way is you just off the counter you get these drugs, painkillers. We call them as NSAIDs, non-steroidal anti-inflammatory drugs. You can use them; they can be safely used. But suppose somebody has severe cramps, then they have to think that there might be some problem, and then they have to approach
Get it checked.
Then coming back to the question, like eating a healthy diet, regular yoga, exercises, that can also help you reduce your cramps.
Okay. And so that was pretty much about the questions that are out there, most Googled questions that people want to ask a gynecologist. But as a woman myself, and knowing that there are women out there who cannot ask this question, for a girl who is, or for a woman who is now ready to have sex for the first time, what are the things that she needs to keep in mind before she gets into it?
See, I think most of the things we have already talked about, So one thing is you should have a safe sex practice. That is very important, You have to prevent yourself from any infections, the sexually transmitted diseases. Then the second thing is, it should not be a trauma for you when you're having it for the first time.
Right.
So you should be having, I think you should consult a counselor before you go in for a sex. You should know the outcome. You're not going in for pregnancy. You're doing it for your pleasure. So you have to follow safe sex practice to avoid infections and a pregnancy. Then that's why counseling, you will know how to have sex, and it should be gentle enough so that you don't have a traumatic experience for the rest of your life.
Right, exactly.
So I think that's what I think is important.
Okay, and of course, that goes without saying that not have a traumatic experience, consent is very important.
Yeah, I think I should have said that. Consent is obviously important.
That is one of the most important
things. I think that is one of these series in Amazon Prime right now.
Right, exactly.
It also says about consent is the important thing.
It is, absolutely. And the last question for the day, as an expert of the field, as someone who knows all of these things, what is your advice to all the women out there as far as their sexual health is concerned, as far as their fertility and infertility is concerned? What all should they keep in mind in general in their lifestyle so that they can have a healthy sexual health?
So before I conclude and come to the conclusion of our today's talk, I would just like to mention, infertility is like a rampant right now. The most common reason of it is because of delayed marriages. That is one of the common causes. We have to understand that once we hit the age of 35, our fertility declines rapidly. So you have to plan your pregnancy as soon as possible. And even if you don't want to plan a pregnancy, we have something called as social egg freezing. You can freeze your eggs if you don't have a partner. And if you have a partner, you can freeze your embryos. And you can get pregnant whenever you want. But at least you have your genes preserved there.
Right.
So that is one thing you should be vocal about, and there's no harm in going to an infertility clinic even if you're unmarried and you say that I want to preserve my fertility. Initially, to begin with, the fertility preservation came in for cancer patients.
Okay,
But
right.
now, I'm sure you must be knowing all
Yes,
these
yes.
film stars and everybody,
They
all
are
you know,
doing it,
this.
exactly.
It's called a social activism.
Exactly. In fact, there is this series on Netflix. It's called The Bold Type. It talks about the entire thing in which there is this woman, one of the main leads. She talks about the fact that she has a BRCA gene, which
That's a
is
breast cancer.
right. So that is when she realizes that okay, I need to plan my life so that I can have a safe pregnancy in the future. And they share the entire process of freezing your
How
eggs.
you go about it.
Right.
Yeah. So that is very important, you know. And don't think it is a taboo. Infertility is not a taboo. It's a treatable, it's not even a disease, I should say. It's
Right.
a treatable condition which can be managed with an appropriate treatment.
Right. Absolutely.
Now, if you want to conclude the session, I would say that women's health in per se, and you can say maternal health. Because, you know, woman or a mother is actually an architect of the society. She is not only a homemaker, she is the person who is laying the foundation stone of a family.
Absolutely.
So
Right.
unless you have a healthy mother, you cannot have a healthy family,
household,
and a
healthy
household.
household. Right. Absolutely.
So it's very important for all you women out there that you should think about your health. Only when you have a healthy, happy lifestyle, you can do everything which is going to be good for you.
Exactly.
So health for all, it's very much mandatory. And you should come up with whatever problems you face. You should not be hesitant because health, whether it's sexual health, reproductive health, I don't think it is anything. It's very rightly said, health is wealth.
Health is wealth.
So
Absolutely.
you do take care of your health and wealth will automatically come.
Exactly.
So
Very
for
rightly
this
said.
developing country like India, where you want to have a rising equity and a decreasing poverty, you have to look into the women's health.
Health. Very rightly
Very
said.
happy International Women's Day to all of you once again.
Thank you so much, Doctor, for giving us an insight and answering all these questions, because there are women out there who I hope that they get to see this and they get the answers that you have offered, because a lot of them, many of them might not have access to a doctor that they can ask, and many of them might be very hesitant to ask these questions. So thank you for coming to us today and joining us and talking about all of this, because it's very important,
Pleasure
as
is
you
mine.
said.
Anyway, thank you.
Thank you, and wishing you all a very happy International Women's Day. Keep listening to ABP Live Podcast.